Imagine stepping into the year 1600. The streets of London reek of wood smoke, horses, and human waste. Physicians in long black robes speak Latin and quote Galen, while barbers with red and white poles sharpen their razors, ready to cut hair or limbs. This is not the world of sterile gloves, polished operating rooms, or anesthetics. This is the raw, brutal age of early modern medicine, where pain was inevitable, infection was a mystery, and hope clung to superstition. Surgeons versus physicians. In the 1600s, doctor was not a single profession. At the top of society stood physicians, learned men, educated at universities, speaking Latin, prescribing remedies made from herbs, minerals, and sometimes dangerous substances like mercury. They rarely touched a patient. Touching the body, cutting flesh, was considered beneath their dignity. Then came the surgeons, many of them humble tradesmen. They inherited their role from the medieval barber surgeons, who not only shaved beards and cut hair, but also lanced boils, pulled teeth, and set broken bones. Surgery was considered a craft, closer to blacksmithing than to scholarship. Surgeons worked with their hands, not books. And finally, there were the apothecaries, mixing tinctures and ointments, and the countless wise women, herbalists, and folk healers who existed outside the official medical guilds. The barber surgeon's world step into a barber surgeon's shop in London or Paris. The famous red and white pole outside symbolized both blood and bandages. Inside, you'd find a chair for shaving, a small table with razors, knives, saws, and perhaps a bleeding bowl. Patients came for a shave, a haircut, or to have a limb removed. Barber surgeons traveled with armies, patching soldiers on the battlefield, sawing through bones while men screamed or fainted. They carried compact toolkits, bone saws, scalpels, forceps, cautery irons heated red hot to stop bleeding. Their reputation was mixed. Some were trusted artisans, others were viewed with fear as butchers of the human body. Humors, blood, and balance medicine of the 1600s was still ruled by humoral theory, a legacy from ancient Greece. Health was thought to depend on balancing four bodily fluids or humors: blood, hot and wet; flame, cold and wet; yellow bile, hot and dry; black bile, cold and dry. Illness meant imbalance. Fever, too much blood, remove some by bleeding. Melancholy, too much black bile, purge it with laxatives. Epilepsy, perhaps an excess of phlegm in the brain. Astrology guided treatments too. Physicians might consult the stars to decide the best time for bloodletting. Even religion played a role. Disease was often seen as divine punishment, and prayers or charms were prescribed alongside surgery. Hospitals and death hospitals in the 1600s were not centers of healing, but often places of last resort. Overcrowded, filthy, and filled with the stench of sickness, they were supported by charity and the church. Patients lay side by side, often sharing beds with little expectation of recovery. The risk of infection loomed everywhere. No one understood bacteria or germs. Surgeons washed neither hands nor tools. The same saw might be used on a dozen patients without cleaning, the blood of one mingling with the next. Survival was as much luck as skill. Plague and war as teachers. Two forces shaped medicine in the 1600s: plague and war. The bubonic plague still stalked Europe. During outbreaks, surgeons and physicians alike were overwhelmed. The infamous plague doctors, cloaked in leather and masked with beaked hoods stuffed with herbs, tried to keep death at bay. Surgeons sometimes lanced buboes, the swollen glands of plague victims, in desperate attempts to drain the poison. On the battlefield, from the 30 Years' War in Europe to skirmishes in the colonies, surgeons honed their craft. Musket balls shattered bones, swords slashed flesh, and cannon fire tore limbs apart. Amputation became the grim but necessary answer. Everyday remedies. Not every treatment involves saws or scalpels. For fevers, surgeons might recommend herbal teas or bleeding. For stomach ailments, purging with emetics or enemas was common. Leeches were applied to draw out excess blood. And always, superstition mingled with science. Amulets, charms, and even powdered unicorn horn were sold as cures. A bezoar stone, a lump found in the stomach of a goat, was thought to cure poisoning if placed in wine. To live in the 1600s was to live in a world where medicine was a gamble, half science, half superstition, and always haunted by death. This was the world into which the surgeon stepped, a man caught between craft and science, superstition and skill. His tools were crude, his knowledge limited, but in an age of pestilence and war, he was often the last hope for the living and the gatekeeper between survival and the grave. On a wooden table, under the flicker of a tallow candle, lay the tools of a 17th century surgeon. To modern eyes, they look more like instruments of torture than medicine. Cold steel, sharp edges, and heavy handles. Yet for the people of the 1600s, these were the only weapons against injury, disease, and death. Materials and craftsmanship. Surgical tools of the 1600s were hand-forged by blacksmiths and artisans. Iron, steel, and brass were the metals of choice. Handles were carved from wood, ivory, or bone. There was no standardization. Every set was unique, reflecting the hand of its maker and the needs of its owner. The bone saw. Perhaps the most feared instrument was the bone saw. Long and heavy, it was designed to cut through flesh and bone in brutal amputations. Battlefield surgeons carried smaller, portable saws, while city surgeons might own larger, serrated versions for cleaner cuts. There were no anesthetics. The patient was held down by assistants, their screams echoing as the saw bit into the bone. Scalpels and knife surgeons also relied on scalpels, small, sharp knives for incisions. These blades were not sterile, often wiped clean on a rag or apron before being used again. They could cut open abscesses, slice away rotting flesh, or open veins for bloodletting. Forceps and hooks. Forceps, tweezers, and hooks allowed surgeons to pull bullets from wounds, hold back flesh, or grasp slippery arteries. Bullet extraction was agonizing, but leaving lead inside the body meant certain infection. Some kits even included screw-like bullet extractors that twisted into a lodged musket ball to pull it free. Trephines. Opening the skull, among the most terrifying tools were trephines, circular saws designed to bore holes into the skull. Trepanning was performed for head injuries, believed to release pressure or evil vapors. A surgeon would place the trephine against the skull and twist until bone was removed, exposing the brain beneath. Few patients survived. Cautery irons. To stop bleeding, surgeons turned to cautery irons, metal rods heated red-hot in fire. Pressed to the wound, they burned flesh shut, the smell of charred skin filling the room. Some surgeons preferred to pour boiling oil directly onto wounds, believing it sealed the body against infection. Bloodletting tools. Since humoral theory dictated that illness came from an excess of blood, bloodletting was one of the most common cures. Fleams, small hinged knives that sliced open veins. Lancets, sharp triangular blades used for precise cuts. Leeches, kept in jars. They were placed on the skin to draw blood more gently. A polished brass bleeding bowl collected the dark red liquid, often decorated with measurement lines to ensure the right amount was taken. No sterilization, no anesthesia. What these tools lacked was cleanliness. Instruments were rarely washed between uses. Surgeons wore aprons stiff with dried blood. Infection, though poorly understood, was a frequent killer. Pain was constant. Patients were given no anesthetics, only alcohol, a wooden stick to bite, or at best, opium if it was available. Speed was a surgeon's greatest virtue. A skilled man might amputate a limb in under 3 minutes. Portable kit surgeons traveled with compact leather cases, folding open to reveal gleaming blades, saws, hooks, and forceps. These kits were carried onto battlefields, into plague houses, and across oceans on colonial voyages. They were symbols of both hope and horror. To the surgeon of the 1600s, these tools were salvation. To the patient, they were terror. Each saw, scalpel, and iron carried the weight of life and death in a world where science was young and every cut was a gamble. The 1600 surgeon was both healer and executioner. His tools promised life, but more often brought screams, scars, or the grave. Among his arts, none were more feared or more common than bloodletting and amputation. The ritual of bloodletting. In a world ruled by humors, illness was thought to boil down to balance. Too much blood, they said, caused fever, madness, even death. The cure was simple: let the blood flow. A patient sat pale and trembling as the surgeon tied a cloth around their arm. With a flick of his lancet or fleam, he opened the vein. Blood streamed into a polished brass bowl, often etched with marks, so the surgeon knew when enough had been taken. For nobles, leeches were preferred, a gentler, more refined method. Dozens of black leeches clung to pale skin, swelling with dark red life. Children, the weak and the elderly, were often bled to the point of collapse, and yet, despite centuries of practice, bloodletting rarely healed. It left patients weaker, their bodies vulnerable to the very sickness they hoped to cure. Amputation, knife, saw, and fire. If bloodletting was ritual, amputation was terror. On the battlefield, shattered limbs from musket balls or cannon fire demanded immediate action. A surgeon would kneel in the mud, tools laid out on a cloth. Assistants held the soldier down. There was no chloroform, no ether, only brandy to numb the mind or a stick to bite. The surgeon's knife sliced through flesh with ruthless speed. Then came the saw, its rasping teeth biting through bone, the air thick with screams. Within minutes, the limb was gone. Bleeding was stopped by cautery irons glowing red-hot in fire, pressed against the stump until the flesh sizzled shut. The smell of burning skin lingered long after. Even in towns and cities, amputations were performed in shops or homes. Crowds sometimes gathered to watch. For surgeons, speed was pride. A slow surgeon killed. A fast one, however, still gambled with infection. Pain, speed, and infection. Pain was universal. Without anesthetics, every cut was felt. Patients fainted or died from shock alone. Infection was even deadlier. Surgeons wiped saws on aprons, reused knives from one patient to another, and handled wounds with unwashed hands. Pus, fever, and gangrene followed many operations. Some patients begged for death rather than endure the agony of post-surgical rot. Yet for every man lost, another survived, often because of sheer luck, a strong body, or a surgeon's merciless speed. Other cures. Not every cure required steel, but many were no less dangerous. Herbal remedies, infusions of sage, rosemary, or willow bark, might soothe fevers or pain. Mercury treatments used for syphilis, mercury ointments poisoned as often as they healed, leaving patients drooling and trembling. Tobacco smoke. Enemas, believed to revive drowning victims, bellows were used to blow smoke directly into the rectum. Bezoar stones, goat's stomach stones placed in wine, thought to neutralize poison. Charms and magic, amulets, prayers, and powdered unicorn horn sold hope to the desperate. To the people of the 1600s, these cures were as real as the knife, and sometimes just as fatal. Healing or horror? The line between medicine and brutality blurred. To the patient, surgery was torment. To the surgeon, it was craft, honed in blood and fire. Each cut, each cure carried the same weight: salvation or suffering. And while many died under the surgeon's hands, others lived, proof that in the darkness of 17th century medicine, there flickered a fragile spark of progress. Bloodletting, amputation, cures that killed as often as they healed. This was not science as we know it, but survival as they understood it. A desperate struggle where the surgeon's knife was both hope and horror, mercy and execution. Legacy, horror, and transition intro. Shadows of the surgeon. The 1600 surgeon was feared and respected in equal measure. His leather apron was stained, his saws forever echoing with screams, his name whispered as both healer and butcher. To some, he was a savior, to others, a tormentor who prolonged suffering. But whether on the battlefield or in a candlelit chamber, he embodied the desperate gamble of medicine before science had truly taken root. Horror etched in memory. The legacy of these procedures was soaked in trauma. For every life saved, many more ended in fever, infection, or shock. Villages whispered of men who survived amputation only to die from rotting wounds weeks later. Families kept bloodletting bowls as grim heirlooms. Superstition fused with medicine, and horror became part of daily life. Yet, these brutal acts carved their place in memory, a raw reminder of the cost of survival in an unforgiving age. Seeds of progress. But even within the blood and screams lay the faint roots of progress. The surgeon's tools, crude as they were, laid the foundations of surgical science. The saw that cut through bone hinted at orthopedic surgery. The cautery iron, though brutal, foreshadowed antiseptic cauterization. The meticulous notes of barber surgeons planted ideas that later generations would refine. What seemed barbaric in the moment was, in truth, a stepping stone toward understanding anatomy, circulation, and surgical intervention. The cultural shift by the late 1600s and early 1700s, whispers of change began to stir. The humoral theory was crumbling as anatomy and dissection revealed truths beyond superstition. The bloody barber surgeon would, in time, give way to the trained physician-surgeon. Universities began to blend scholarship with practice. Slowly, society started to separate quackery from knowledge. Yet, the old fears lingered. Even as science advanced, patients still flinched at the sight of the surgeon's saw, the iron in the fire, the cloth ready to bind. Reflection between horror and healing. The legacy of 1600s medicine is one of paradox. It is a history of men who wielded steel without anesthesia, who cut because there was no other choice, who drained blood in the name of balance, who prescribed poisons hoping for cures. They were feared, yes, but they were also pioneers, forging a brutal bridge between superstition and science. When we look back at the surgeon's toolkit, the saw, the knife, the bleeding bowl, we see more than relics of horror. We see the earliest attempts of humankind to wrestle with disease, pain, and mortality. They remind us that progress is never clean. It is born from blood, failure, and courage. And so, the surgeon of the 1600s stands in history's shadow, half healer, half executioner, but above all, a necessary figure in humanity's painful march toward modern medicine.